Nobody likes to talk about liposuction on their abdomen. It is the least discussed liposuction for lipedema. And nobody wants to show before and after pictures. I shared some pictures of my abdomen post-op. I'll be honest with you, it was the most difficult of the 3 surgeries that I had. The recovery was more difficult than for my legs and arms, and I really attribute that to just being that your torso is responsible for so much movement of your body. When I first met Dr. Bird, she was the one who told me that I had lipedema in my abdomen, my lower abdomen as well as in my rib cage. And I remember lying down and starting to palpate the line across my ribs, and I felt all these little marbles on my rib that I didn't realize were lipedema. So once she told me that and I completed the leg surgeries, before I left the office that day, I scheduled my appointment for the abdominal liposuction for March the following year. So just three months later, we came back and went through the liposuction for my abdomen. This is a really important piece of the story because many women experience fat growth in the areas of their body that still have lipedema in them after they've had their legs or their arms done. So I wanted to make sure that I had the best possible results, and I did not want to go through the experience of my abdomen increasing in size. So I went ahead and scheduled the liposuction for my abdomen at that time. I'm glad that I did that. I know a lot of people who have had that experience where they didn't have their arms done and then they ended up with lipedema in their arms. You know, fat is a nasty thing and it finds a place for it to go. And if you get rid of fat cells in one location, then it says, aha, let me find some other place that I can deposit this fat. And I was keenly aware that that was a risk, and it was a risk I didn't want to take. Many women also have an increase in the size of their breasts. Fortunately or unfortunately, depending on what your situation is, that doesn't always happen. I did not experience that, but I really attribute that to the fact that I went ahead and did the 3 surgeries in order to prevent the recurrence of lipedema at another body site. So I had my surgeries for my legs and arms 3 days apart in November. And the reason why we couldn't do the abdomen at the same time is because we had already reached the limit of the amount of fat that could be removed at one time. Dr. Bird carefully monitors the hemoglobin, and also the tumescent fluid that is inserted into your body contains lidocaine, and it can become toxic if there's too much in your system. So we gave my body a chance to heal 3 months, and then I came back for my abdominal liposuction. The recovery for the abdomen is tough. Personally, I had a lot of bruising, way more than on my legs. My skin turned black, and I had a lot of itching and no comfortable sleeping position. But within 3 weeks, I was back to normal. I went to work 1 week after my Actually, I had my liposuction for my abdomen on a Wednesday, and I was at work on Monday morning. So even though I'm telling you that it was difficult, I was able to return to work, and I think other than kind of feeling guarded or looking like I was guarding my body, I don't think that anybody would have known what I had just put my body through.